Now, from WTVM, this is Business Break with your host, Maureen Akers.
Hello there and welcome. Today our special guest is Dr. Stephen Cooper with Phenix City Spine and Joint and Phenix City Joint and Rehab. Good to see you.
Thanks, Maureen. It's great to be here.
Absolutely. Well, now tell us, how do the Phenix City Spine and Joint and the Phenix City Joint and Rehab Centers work together to provide services?
It's been a great collaboration to bring together chiropractic and medicine to try to get two fields to work together to provide the best possible outcome for patients. We see a lot of different patients with a lot of different backgrounds and different injuries and whatnot. And a lot of times medicine can offer this and chiropractic can offer that, but together I think they offer a much better outcome for the patient.
Oh yeah, very good. Now, we were talking a little before we went on camera. Did we hear that Medicare and TRICARE might actually start paying for regenerative medicine? Tell us more about that.
Well, one of the things we started to really get into were how can we get more natural, more holistic, more types of ways to treat patients that went along the chiropractic mentality, but allowed the full expression of what medicine can do for patients with arthritis and some of these different things. And people are paying a ton of money getting regenerative medicine and stem cell things done. Well, we've been able to get set up so we can do some regenerative medicine under the right patients with the right diagnosis that VA and our TRICARE and Medicare will actually cover. And the results have been phenomenal. And we're excited about what we've been seeing come back from some of these patients. And using Hyalgin and some of the other things that we're doing, the results have been good. And hopefully we can continue to provide this type of treatment to this community.
Oh, that is fantastic news. Now tell us a little bit more. You also have a treatment center where you can treatment in a surgery center, I think, with people that maybe have suffered from an auto accident or even a frozen shoulder. Tell us more.
Yeah, it used to be when I first started. I spent 2 years establishing the military chiropractic program and got exposed to something with that, where chiropractors and medical doctors working together called manipulation under anesthesia. And it used to be we would treat a patient and maybe they would lose a certain range of motion. They couldn't raise their shoulder so high, or couldn't bend their knee all the way, or they'd have these issues. Well, when we would go and do these patients under anesthesia, and we would have all the providers there, we have an anesthesiologist, a pain medicine, we have chiropractors working together on their patients, we could now break up the scar tissue. We could now restore lost functional range of motion. We can now take someone who maybe had a mastectomy and they're all this scar tissue in here and get that range of motion back. We had a patient with a severe torticollis and we could do the same. So these are the types of things that we're excited about doing. When someone's in an accident, boom, we can get them back to where they need to be quicker.
Oh, fantastic. Information has been on the screen the entire time we're talking. Call Dr. Cooper and his staff. Thank you so much, and we'll see you on the next Business Break.